The image pattern seen during endomicroscopy differs as per the cyst type. The first cyst of interest is IPMN. The IPMNs are lined with epithelium which have a papillary configuration. A typical papillary structure as shown in this picture shows an inner vascular core which is bright because of intravenous fluorescein which we administer to the patient before endomicroscopy. The inner vascular core, otherwise the lamina propria, is surrounded by an outer epithelium which is dark in color. The darkness is mainly because of the nuclei since they appear dark during endomicroscopy. These papillae are seen in various shapes and forms. Here are various possibilities. You have overlapping papillae as shown in figure 1. Figure 2 shows the transection of a very large papillary structure with outer epithelium, inner vascular core. Figure 3 shows a much darker papillary epithelium with some nuclei near the basement membrane. Again, it's a kind of a transection. And figure 4 shows IPMN with low-grade dysplasia. The papillae are thin, the epithelium is thin, and there are multiple papillae in the field of vision. Here are some more examples. In the top panel, you again see multiple papillae in IPMN with various length, thickness, configuration. The key hallmark being that central vascular core and the surrounding epithelium. In the bottom panel, you have the vascularity in IPMN, where you see parallel running blood vessels described as the rope ladder type of vascularity. Another point to be noted is that we rarely see isolated or large papillary structures since most IPMNs are somewhere between low grade, intermediate to proceeding to high grade dysplasia. As dysplasia progresses, we get to see these large papillary structures, sometimes which occupy the entire field of vision. Here in these videos, you see much flatter, thinner epithelium, a feature of IPMNs with low-grade dysplasia, and you will see IPMNs with multiple papillae. It's overlapping papillae as seen in this video, and sometimes it looks like the gyri and sulci of brain. Another example with some beautiful looking papillae in a case with IPMN. These videos just show the differences between IPMNs with low-grade and high-grade dysplasia. Generally, low-grade dysplasia IPMNs have much thinner, flatter papillae, whereas those with high-grade are thicker, larger papillary structures with a much thicker and darker papillary epithelium. Moreover, the vascularity also tends to get more intricate. From the basic rope ladder pattern where the blood vessels are parallel, the vascularity gets more networked, more intricate. The next pancreatic cyst we will review are mucinous cystic neoplasms, or MCNs. The key feature of MCN is visualizing the epithelial bands. And these are either singular or they could be multiple in layers. The second key feature is visualizing inflammatory cells. Some MCNs may or may not have these inflammatory cells or clusters of inflammatory cells. Sometimes there could be a dark background suggestive of atrophic epithelium with bright shiny macrophages similar to pseudocysts. In this video you see multiple layers of thin flat epithelium. The inflammatory cells could be seen in clusters or groups. Again, another example of epithelial band in mucinous cystic neoplasm. Occasionally we see these large, round, isolated cells which we think are luteal cells, which are a feature of the ovarian stroma. But MCNs demonstrate both these large cells and clusters of clumps of inflammatory cells. Again, more examples of epithelial bands seen in cystic neoplasms. Coming up, we will review both cystic neuroendocrine tumors and pseudopapillary neoplasms. Both these cyst types demonstrate the trabecular pattern. We cannot differentiate between these two cyst types just by endomicroscopy. Both the cyst types demonstrate a trabecular pattern, which is nests or clusters or cards of cells which are separated by the stroma of the cyst. Here is an example of cystic neuroendocrine tumor. What we see are cards or groups of cells which are separated by the stroma of the cyst. Some early learners of endomicroscopy might confuse this for the Fern pattern of vascularity seen in serous cystic adenoma. But it's important to note that the spaces between these groups and cars of cells are not filled with RBCs, meaning that those are not blood vessels. This is just the stroma separating these groups and cars of cells. Here is an example of solid pseudopapillary neoplasm. Again, very similar to the cystic neuroendocrine tumor. There are cards or groups of cells separated by the cyst stroma. Here you see more of cards of cells than nests of cells. The spaces between these groups and cards of cells do not have any red blood cells flowing through them. The next cyst type we will discuss are pseudocystadenomas. These don't have an epithelial pattern but rather have a very characteristic vascular pattern, the so-called Fern pattern of vascularity. Here you see multiple blood vessels which branch off from a central blood vessel, and these tend to run parallel to each other. You might see these blood vessels packed with RBCs. In the lower panel you see blood vessels which appear dark. These are packed with RBCs. And in the upper panel you see blood vessels which are bright in color because of much penetration by contrast. In the next few videos we will see pseudocystadenomas with both types of blood vessels, where you have a higher penetration of contrast and the blood vessels appear bright. And in those where there is a lower penetration of contrast, or the blood vessels are packed with RBCs, hence giving it a much darker color. In this example, you see blood vessels with flowing RBCs. There is a higher density of RBCs at certain areas. There is a very characteristic Fern pattern as described. And here again there is a higher density of RBCs within those blood vessels. In this next example though, you see that the blood vessels appear much brighter compared to the previous example. The last cyst type we will review are pseudocysts. Pseudocysts generally have a dark background with bright particles. The inflammatory cells, typically macrophages, can show autofluorescence. Some pseudocysts though have a very bright background. As seen in this video, you also see poorly organized groups and clumps of inflammatory cells against a bright background. The bright background is most likely due to the exposed part of the pancreas, typically when the needle is too deep. In this example, the cyst background is dark because of lack of blood supply. The bright particles are macrophages which have autofluorescence. In this last example, you see a very poor uptake of fluorescein with lack of blood vessels, and the background is featureless and dark with some autofluorescent inflammatory cells. Now that you have a good idea about these image patterns, we'll quickly recap. IPMNs, the typical feature is seeing papillary structures. In IPMNs, they could be really flat with low amplitude, meaning the papillae are much flatter without the typical papillary configuration. Or as the dysplasia progresses, you will see IPMNs with much larger, prominent, darker, thicker papillae. The next cyst type, which is myxinocystic neoplasms, have much flatter epithelial bands. They don't have the typical papillary configuration, and more often than not you tend to see clusters of inflammatory cells and sometimes a dark background with bright autofluorescent inflammatory cells. When you group both these myxinocysts together, that's IPMN and MCN, the hallmark is seeing epithelium. Whenever you see epithelium, that's either IPMN or MCN. Now, it's sometimes challenging to differentiate between MCN and a IPMN with low-grade dysplasia, which has much flatter epithelium, and we will discuss that in the next few slides. The next cyst is pseudopapillary neoplasm or cystic neuroendocrine tumors. Both these have the same image pattern, that is clusters or groups of cells which are separated by the stroma of the cyst. This is very similar when you see the histopathology of these two cyst types. And again, this feature or the trabecular epithelial pattern is only seen either in cystic neuroendocrine tumor or pseudopapillary neoplasm. Serous adenomas, on the other hand, do not have any kind of epithelium. What they have is intricate networked blood vessels, which we see as this fern pattern of vascularity or the superficial vascular network. Finally, cirrhosis, which don't have a true wall, don't have blood vessels within the wall, are typically dark, and they show a lot of inflammatory cells. These inflammatory cells can be autofluorescent, or they could be dark clumps of inflammatory cells seen against a bright background, which is the underlying pancreas. Here are some challenges in differentiating cyst types based on endomicroscopy. The first is differentiating IPMN with low-grade dysplasia from mucinous cystic neoplasm. As stated before, both have thin and flat epithelium. Some low-grade IPMNs may lack the typical papillary configuration. To compare, MCNs have a thin epithelium. The epithelium is flat, sometimes in very thin layers. The background can be dark because of atrophic epithelium, or the background is typically more usually bright and you see clumps of inflammatory cells. On the other hand, IPMNs with low-grade dysplasia, the epithelium is slightly thicker compared to the MCN, and you may see some papillary configuration, but there are hardly any inflammatory cells. You never see a dark background. Note that in clinical practice, it's way more frequent that you encounter an IPMN with low-grade dysplasia than MCN. Again, to compare, here is the video of MCN. There's a background of some inflammatory cells. Again, here is a dark background with some bright particles, which are again inflammatory cells. Dark background means atrophic epithelium. Now you see very flat epithelium, thin layering of the epithelium, which is a diagnostic of mucinous cystic neoplasm. Now here is IPMN in comparison. You see that this is an IPMN with low-grade dysplasia. You see layering of epithelium, and there is some type of papillary configuration, but you can hardly differentiate. But there are hardly any inflammatory cells in the background, and you never ever see this dark background with bright particles, which we see in MCNs. Next challenge is differentiating cystic neuroendocrine tumor or pseudopapillary neoplasm, which is the trabecular network, from the typical fern pattern of vascularity seen in serous adenoma. In the trabecular pattern, what separates the clusters and groups of cells is the stroma of the cyst, whereas in serous adenoma, it's a network of blood vessels, and in this network of blood vessels, you tend to see multiple floating RBCs. Moreover, in serous adenomas, within these blood vessels, you occasionally see clumps of RBCs as well. Here is a video of the trabecular epithelial pattern of cystic neuroendocrine tumor or pseudopapillary neoplasm. You see groups and clusters, or sometimes cords of cells. These clusters are separated by the stroma of the cyst. Spaces between these clusters do not have any RBCs in them, do not have any floating RBCs in them. The clusters and groups are in various shapes and sizes. The image pattern is produced because these two lesions are highly cellular compared to the other cystic lesions. Here are 4 different patients with serous adenomas showing the fern pattern of vascularity. These are essentially the capillaries which kind of occupy the entire cyst. When we do endomicroscopy, these images move very quickly, and we get to see this beautiful pattern of blood vessels. Essentially, there is a central blood vessels from which other blood vessels branch off. You get to see RBCs floating within these blood vessels, or sometimes blood vessels packed with RBCs. Since we are evaluating these lesions or the endomicroscopy of these lesions without background clinical features, it sometimes is difficult to differentiate a mucinous cystic neoplasm from a pseudocyst. The key difference is that in mucinous cystic neoplasms, you will see thin epithelium, which is the hallmark. You also get to see these dark areas and clumps of inflammatory cells. Now, pseudocysts never reveal an epithelium, and most of the cyst is either dark with some autofluorescent inflammatory cells. Occasionally, you may see a bright background, which is because of the underlying pancreas, and against that background, you tend to see clumps of inflammatory cells.